Earlier this year, Marta Varga, a Chewelah resident, was told she had cancer and shortly after was told the drug she needed was in short supply. It's a problem many cancer patients and doctors are navigating right now as they try to find alternative treatments.
4 News Now's Natalie Grant is live for us tonight and shares how local patients are being impacted. Natalie.
Well, Aaron, Kirsten, local oncologists are keeping an eye on this short supply and having to potentially tell their patients that these life-saving drugs might not be available. And for patients like Marta Varga, the news of this shortage has left her dumbfounded as she faced off in her cancer battle. The last 2 years have been hard for Chewelah resident Marta Varga. After a series of medical problems, earlier this year, she was diagnosed with endometrial cancer, only to be told the drug she needed was not available.
I just didn't understand how that can happen. What you mean you don't have a cancer drug? I mean, this is the United States of America. This is the best country in the world.
It's a situation becoming far too common for cancer patients due to a lack of supply of 4 generic treatment drugs.
We use them in ovarian cancers, cervical cancers, lung cancers, breast cancers.
Dr. Gourley, who is an oncologist at MultiCare here in Spokane, says it's been a tough situation for patients and doctors alike.
Meeting with someone for the first time saying, "Hi, you have cancer and we want to treat you. Normally I would give you this drug, but because of a drug shortage, we have to give you something that may not work as well." That's really tough. We'll give them the best option that we have, and we've been very open with our patients about the drug shortage. And it has caused a lot of anxiety in those patients.
Gourley saying the shortage has really ramped up in the last couple of months due to an overseas production center being shut down, and the impacts could go on for another 6 to 12 months, time that some cancer patients don't have. Now, when it comes to how these drugs are distributed, Dr. Gourley says it all comes down to whether those cancers can be treated or not. And as for Marta, in her case, her alternative treatment and the small amounts of that correct drug that she has been given has worked in her favor. Recently, she was told by her doctors that she is now cancer-free. So even though this is a tough situation, there is still hope on the horizon for some. Reporting in Spokane, Natalie Grant, 4 News Now.